Can you hear the music? Can you hear the music?
All right, I can see there's a few people logging on now. We'll just wait until everyone joins us. Excellent. The raise hand function looks like it's working as well. I'll discuss that in a minute. Alrighty, we might get started so we can get through everything. So I just wanted to say thank you so much for joining me tonight. It's great to have so many people on board. So just before we do continue and get into things, I just want to run through a few housekeeping things. So first of all, there should be down the bottom of your screen a Q&A tool. And so at the end of the presentation, there'll be a question and answer time that we've allowed. So if you do have any questions, please use, just click on that box and you should be able to send some questions through. I'll be able to see them. I'll try and get through as many as I can tonight. There's also the hands up button, which a few of you have already seen, which is excellent. So I'll be asking a few questions tonight, and I'd love if you could raise your hand virtually so that I can see how many people are feeling the same way. Also, just wanted to let you know that after the webinar today, I'll also be sending out an email, so you'll get that tomorrow with some resources and links to things that I chat about tonight. And also, if you've got a pen and paper handy, then that's great. If you've got any notes to take from things that we chat about tonight, or if you have any questions, just write them down if you want to hold on to them for a bit. And I'll also be asking you some questions, so if you can just write down your reflections to those questions as well. All right, we've got a few more people on, but I'm going to get into things for the sake of time. So we'll move on to the next slide. So by the end of this webinar, it is my hope that you understand, first of all, what actually happens inside of our bodies as we age. So the processes of how tissues and organs adapt and how they decline over time. I want you to understand that the onset of these aging processes can be prevented or prolonged through appropriate physical activity. And lastly, I want you to understand how to get started and working our way up to meeting the physical activity guidelines if we don't already. But before we get into that, I just thought I'd share a bit about myself. So my name's Kelly. I am an exercise physiologist at Target Physio here. I will talk more a little bit about exercise physiology and what I do day to day a little bit later on in the webinar. I really enjoy being active and playing sport. I love spending time with my friends and family, although virtually lately. And I've also been getting into cooking recently, which my husband is very much delighted with. I have a real passion for older adults and exercise for older adults. And I love doing that because it's ensuring that the more mature members of our community age well and they maintain their activity for as long as they can. So I'm involved in a few older adult exercise initiatives around the community, and I just love seeing how it connects people and just brings people together. So, quick overview of the webinar. So we're looking at three main questions. So our first question is, what is the aging process of? We'll look at muscles, bones, joints, the brain, and we'll touch on balance and falls as well. Our second question is, how can physical activity help? So we'll look at how it helps the aging body, and we'll look at how it helps chronic diseases as well. And our third question is, where to start, or am I doing enough? And in that, we'll look at the National Physical Activity Guidelines, and we'll also look at exercise physiology as well. And then we'll finish off with a question and answer time at the end. So before I do get into anything though, I really want to emphasize that it is normal to have changes in your body. It's normal to have age-related changes that happen inside. On the outside of the body, it looks like grey hair, it looks like wrinkles, it looks like an extra bit of flab here and there, but it's the same for your insides. There's going to be normal changes in your body. So I don't want you to feel that too overwhelmed by anything we go through tonight. So just have that in your mind. So we'll look at the aging process of muscles first. So muscles consist of different fibers that use different mechanisms to metabolize the energy that comes into your body. So loss of these fibers due to age or lack of use can lead to inflammation. It can lead to fat infiltration or adipose infiltration in the muscle, fibrosis, and reduced capillarization as well. So when we exercise or do certain movements, there are micro tears that form in our muscles, and the body recognizes these tears and they'll repair them to make the tissue stronger. So with age, there's a reduction in these cells that the muscles rely on for muscle repair, for protein synthesis, and therefore we can lose our strength. So as muscle ages, the motor units that innervate our muscles, so tell our muscles to move, they also decrease, which can lead to changes in our muscle composition as well. So circulation issues might arise and affect how oxygen is delivered to our muscles, which can reduce our endurance. So that might be why you feel like you're getting tired a lot quicker as you age as well. Your muscles are getting tired. So for our muscles, it's about what's on the inside that counts though. So it's important to emphasize that it's not how big your muscles are, although I'm sure there's people out there who love their big muscles, but it's all about function is the most important thing. So age-related loss of muscle function is known as sarcopenia, and it's a common diagnosis in adults. However, it's not a life sentence, as we will discover very shortly. All right, so we'll go on to the aging process of bones next. So bones serve multiple purposes in the body. So other than keeping us upright and not looking like jelly, they protect our internal organs. They allow us to walk and to weight bear. They're home to our bone marrow, which helps create our red blood cells, and they're a reservoir for our calcium homeostasis. So with aging, all of these functions can become impaired. Our bones stay strong through the bone remodeling process. So that is a bone tissue is resorbed. That's a process by which these cells called osteoclasts, they break down the tissue in the bones, release the minerals into the blood, and then these other cells called osteoblasts come in and they lay down new bone, which is created, and it's nice and shiny. When this process slows down, calcium stores can be depleted because there's less going into the blood. And so this is why you might hear for older adults to increase their calcium intake in their diet as well. So when that bone is broken down at a faster rate than it's applied, it can cause our bones to become a bit more weak and a bit more brittle. So this can often lead to a condition called osteoporosis, which I'm sure you've heard of. And unfortunately for us ladies, it is more common in women, and particularly postmenopausal, as there's hormone changes that go on significantly during menopause, which affect our bone mineral density. So the strength of a bone as a tissue is determined by the amount of mineral that there is, so what is that bone mineral density. And this can also be a marker for fracture risk as well. Therefore, balance and falls prevention is also something that's emphasized. So I will talk on that later on as well. So when you lose bone mineral density, the bones can also become thinner. So You might see this visually with someone if they have that bone mineral loss in their spine and their vertebra, that they actually shrink a little bit. And so that's due to the reduction in bone mineral density. And a reduction in that can also lead to osteoporosis. So the aging process of joints. So joints can be the cause of a lot of pain for some people and discomfort as we get older. But before we get into the nitty-gritty of joints, I just want to emphasize that a joint is just not the two surfaces that join together. It's actually a capsule. So they've got as you can see in the photo there, it's a joint capsule, so the membrane itself, the two bones with the articular cartilage and the joint fluid as well. So as our body matures, the cartilage may degenerate and begin to rub together and can cause the cartilage to become thinner. So the fluid that's in our joints may also decrease, and this fluid is there to reduce the friction of the joints, of the cartilage as well. Joints can become stiffer and less flexible due to changes in the connective tissue of our ligaments and the tendons that surround the joint. And rigidity of these areas can lead to limited range of motion in our joints as well. So this is concerning for things like our hips and our knees and ankles because we need these joints to work in their full range to, again, avoid falls and trips and things like that. All of this together might cause the joint to become less resilient and susceptible to damage as well. And in some cases, there might be a diagnosis of arthritis. So arthritis affects the whole joint, including the bone, the cartilage, the ligaments, and the muscles. And although osteoporosis is usually described as wear and tear, the condition itself is actually the result of a joint working extra hard to repair itself. So I'll chat on that a little bit later on as well. So here I want you to use your hands up tool. So who has ever heard any creaking or cracking or popping coming from their joints? Yep, lots of hands. Oh, it's filling up my screen. Okay, yes, so very, very common to hear those creaks and those cracks. We can often think of those noises as being something bad. For instance, when you hear noises coming from your car, usually it's a bad thing. Usually it sounds expensive and just really inconvenient. However, hearing creaks and cracks and pops is very common occurrence and it's very normal as well. So as the cartilage wears away, this can cause more noise from that rubbing. There could be little bubbles in that joint fluid that just pop when we move. And it could just be the sound of a muscle tendon moving over a bony surface of a specific bone. So those can be some of the causes of those noises. However, if there is a cracking or pops, but it's accompanied by inflammation or consistent pain and swelling, that's when it's worth seeing a health professional for some advice. All right, so got a bit of a humorous interlude here. Just gone through some heavy stuff. So it gives you a bit of a clue to our next topic as well. So before I get into that, I'm just going to take a sip of water while you enjoy those cartoons. So you may have guessed that we are going to talk about the aging process of the brain next. So our brains are responsible for a lot of what we do every day. It helps us to perceive the things around us, sends messages around our bodies, and reminds us to pick some milk up on the way home for breakfast tomorrow. So as we age, our brains shrink in volume, particularly in our frontal cortex of our brain. So the frontal cortex is the center for speaking, for body movement control, problem solving, writing, and concentration. And so significant degeneration in this area can also contribute to conditions such as Alzheimer's and dementia as well. So memory decline also occurs with aging, and brain activation becomes more bilateral, so you use both hemispheres of the brain just to complete memory tasks. So as mentioned, the frontal cortex is responsible for our body movement control. Therefore, degeneration can contribute to loss of coordination in our motor skills as well. There's also changes in levels of transmitters and hormones, which help to regulate our cognitive and our motor performance as well. So again, I'd love you to use the hands up tool. Show of hands, who has felt a bit more wobbly on their feet than they used to? Yep, getting a few hands there. Yep, very common. And so like our memory, our balance is something that can decline over time if not trained. So our balance is comprised of 3 different systems. So our first system is our vestibular system. So our inner ear, in our inner ear, we have semicircular canals that fluid passes through. Our brains gather information from the ratio of flow of this liquid in the canals to work out the orientation of our head, therefore contributing to our spatial orientation and our balance as well. So we've also got our visual system, which is our second system. So our eyes give us so much input for our brains to process. So to perceive how deep we need to step down, how far away the crossing is, or how close you are to the car in front of you when you're driving, things like that. And as we age, our vision can decline and our brains can become slower to perceive the information that we see. So if we get injured or if we decondition, our brain begins to rely less on our periphery, so our proprioception, which I'll talk about in a second, and becomes more dependent on our eyes. So it's important to practice things, our balance exercises with our eyes closed, one eye closed, things like that. Which leads into then our proprioception, so it's our third system. So this is our body's ability to perceive our position in space. And to know where our joints are, what they're doing. It's our ability for our body to know that my finger is bent at the moment, or if we're walking on uneven ground. So those are our balance systems. I also want to touch on our falls as well. So there are some alarming statistics about falls and how preventable they actually are. So there's many things that contribute to falls. So our first one being weaknesses, so of certain areas in our body. So for instance, if your knees become a bit too weak, or if your hip flexor muscles that lift your knee to help you take a step become weak, then it's a trip hazard, and because you can't actually lift your foot high enough to take the step. Our second one is our reaction time. So like I mentioned, the brain can slow down, which means that messages can get sent to our body get slower, and our reaction time is reduced. So think about it, if you're in a busy shopping center and someone's rushing past you and they accidentally bump you, you want to know that you can take a step out to the side to regain your balance and react quickly enough. Our third one is hazards. So things like pets and toys and furniture, they all make your house feel like a home. And believe me, I love a good Persian rug on the lounge room floor. But these are all examples of trip hazards. So I'm definitely not saying to get rid of all the furniture in your house and you can't decorate it and you've got to get rid of Fluffy the dog or anything like that. But it's definitely worth taking stock, having a look around and seeing what's in your house, and fixing it if you see that it's a potential hazard. So something like a rug, for instance, if it's starting to curl up at the end, can be a trip hazard. So popping some tape down or something heavy onto it so it stays down is a great way of fixing that hazard. And also chronic diseases can sometimes affect falls as well. And because the effects of the diseases might lead to decreased sensitization in our feet or our legs, or they might be known as neuropathies. And so even though you might experience a neuropathy, it's not an excuse to avoid training balance as well. I didn't mention this on the slides, but a common something else that contributes to falls is lack of common sense. So sometimes people, they might be injured or a bit more frail and they decide it's a good idea to climb a ladder or step on an uneven chair, that kind of thing. So best way to do that is to ask for help. To avoid falling is to ask for help. And don't be afraid to do that. All right, so now that we've chatted about aging and all things that can happen to our body, you might be feeling a little bit overwhelmed. But I do want to emphasize again that changes in our body are a normal thing, and that it doesn't have to be all doom and gloom, and that, you know, none of these things might affect your day-to-day activities as well. So there is hope nonetheless, and that is our physical activity or movement or exercise, whatever you would like to call it. It's important and it can help you. I understand that it's definitely not everyone's favorite word to hear exercise or movement, and sometimes it's not easy to do as well, but it's yeah, it's important. And so yeah, let's look at some of the ways that it can help you. So let's start with our muscles. So when we exercise, particularly when we do muscle strengthening exercise like lifting weights, our muscle fibers sustain those little micro tears that I talked about earlier on. So that our body then uses the protein to fix up. So I like to think of it like a scar when the skin tissue is teared or torn. The body then heals itself and skin is thicker. So it's the same principle for our muscles, that when micro tears form, they're healed, the muscle fiber becomes stronger. So strengthening your muscles is important for a number of reasons. So, but most importantly in my book is that it keeps your capacity to do your everyday tasks. So if you let your muscles decondition, you'll find things like getting off the toilet a lot harder. You'll find things like picking the groceries up a lot harder, opening a jar of jam, lifting up the fry pan, things like that become a lot more difficult. Having decent muscle strength also helps to protect our joints. So it reduces the load on them and therefore can improve their function and reduce pain as well. So physical activity can also maintain and can improve our endurance. So it keeps us strong to maintain our ability to avoid fatiguing quickly. It also increases our circulation and maintains that innervation. So the messages that our brain sends to our muscles, it keeps those pathways there for our body to retain. I also just wanted to touch on the progressive overload principle as well. So our bodies are amazing in the ways that they can adapt to load. So the progressive overload principle involves increasing the demand on our muscles to continually and progressively make improvements in our strength. So if you're one of those people who do the same sets and reps and weights and exercises for years and years and years, then it's time to shake things up a little bit and challenge your muscles, because they can adapt to more. So physical activity on bone. So strength training is not just for muscles, but it's for bones as well. So like muscle tissue, bone is living tissue, and it changes in response to the forces that are placed on it. Our muscles, they are attached to our bones, and so when we do our strength training, our muscles contract and relax, but their contraction, it pulls on the bones and sends a message to the bone that new bone needs to be laid down. So other than resistance training, things such as moderate to high impact exercises or activities, such as walking, jogging, dancing and stepping, are great ways to improve our bone mineral density and to keep them strong. I also just wanted to mention swimming in here as well. So swimming is an amazing exercise. It's really, really good. However, I do recommend that it's done in conjunction with some higher impact activities or some weight bearing activities, because doing swimming alone won't have the improvements and it won't help you to maintain your bone mineral density. So next we'll look into how our physical activity can help our joints. So the main thing I want you to take away from this part of the slide is that motion is lotion. Rhymes, so it's easy to remember, but physical activity boosts the circulation of our joint fluid, which we know is there to reduce the friction in our joints. And so if you think of a car engine, you put oil and the fluid makes it run smoother, but when the car isn't driving, the oil just sits there idly rusting away your engine. So it's the same thing for the joint fluid in our in our joints. Exercise can also help to improve the joint tolerance. the flexibility and range of motion, as the ligaments that surround the joint they're being moved and they're being worked. So physical activity is also it's necessary for weight reduction. So with a reduction in our weight, we take some of the stress off of our joints. So research also shows us that exercise is vital in the management of osteoarthritis. So if you do suffer from osteoarthritis and you'd like some guidance, we do have our physios Tom and Cameron. They run a program specifically for osteoarthritis of the knee and the hip. And again, you'll get more information and a link about that in your post-webinar email. So the brain, how can exercise help the brain? So when we exercise, we need to engage our brains to perform movement. So this contributes to a reduction in age-related decline in brain volume. So it improves the blood flow to the brain, improves oxygen delivery, and helps to retain our neural pathways as well. So evidence also shows that it decreases our risk of dementia and mental illnesses as well. Group exercise is a great way to improve our mental well-being as well. So combat loneliness, which can be very common in older adults, and it really encourages that social interaction, which has more benefits than we actually realize. And again, balance and falls, wanted to just connect all of that in because it's all connected to each other. The brain, it stays active, allowing us to process and perceive what's around us. Exercise keeps our muscles strong to be able to react and lift our legs when we're walking. It allows our joints to move through their normal range of motion. It's all connected and can all improve and decrease your risk of falls as well. So I also wanted to touch on chronic diseases as well. So I understand that some of you might have a diagnosis of something from your GP or have something that you've lived with for years. However, I want to encourage you that a diagnosis is not a life sentence. I understand that it can affect how you might approach exercise. For instance, if you've got weaker bones, then there may be a fear there for having to do an exercise that might be a bit uncomfortable for you, and for people who have weaker muscles as well, then it might feel painful to do exercise. But exercise is a vital inclusion in the management of any chronic condition to avoid progression of that disease, so helping it from getting worse. So exercise physiologists, like myself, we're experts in prescribing exercise and movement strategies that take into account, your environment, your history, your side effects, your medications, and we create something that's client-centered just for you to ensure that you can have the best quality of life no matter what health journey you're on. So now that you've heard all about physical activity, I'm sure you're raring to get going. And I do want to encourage you as well, if you do have any questions, please you do use that question and answer tool down the bottom, and I'll go through those at the end. But now you're raring to get going. Some of you will probably already be sufficiently active, but the best way to measure this is through the use of the physical activity guidelines. So I want you to think about these questions, and you can write your answers down if you've got your pen and paper there. Question 1 is, what am I currently doing? So average of the last couple of weeks, how many minutes, what kind of activities are you doing? Second question, does it meet the physical activity guidelines for someone my age? So we will touch on that in our next slide. If not, where can I make the time to be more active in my life? So I do want to emphasize on this point that you don't need to make exercise a big deal. You don't need to clear out 30 minutes in your diary every day. I understand that some of you watching might still be working full-time, part-time, or have other responsibilities that are definitely prioritized above exercise. But I think the easiest way to meet the guidelines is just to have a think about what you can do throughout the day. So for instance, if you've got 2 minutes while the kettle boils in the morning, that's 2 minutes you could be doing some exercise. If you've got some time while you're waiting to pick up the grandkids from school or something like that, then that's, that could be 5 minutes where you could be doing some walking. So you'd be surprised if you looked at your day, how many times you would have where you're either being still or you're waiting for something. And so that's probably the easiest way to accumulate some more exercise in your life. And the last question is, if I am being sufficiently active, is there anything I need to include in my physical activity to get the most out of it? So if you're meeting the physical activity guidelines, then that is fabulous. Keep going. But I do want to challenge you to think about, the types of activity that you're doing. Like I mentioned before, if you're just doing swimming, then it's a really good idea to include some more weight-bearing exercises to keep your bones strong. By varying your exercise, it also keeps things fresh and really interesting as well. Keeps you interested for longer. If you feel like there might be a bit of a mental barrier to getting started, such as low motivation or lack of self-confidence, it's all a real thing. And you can discuss this with your exercise physiologist or a counsellor as well. So we are fortunate enough to have Jo from the Life Counselling Centre. She practices out of our clinic at Kenmore and online. And she specialises in helping through weight management issues and chronic pain and trauma as well, and other barriers that you might have to exercise. So there's plenty of people that can help you start and overcome things. So like I mentioned, we have our physical activity guidelines that the government has introduced. And so the first one for all ages pretty much is that doing any physical activity is better than doing none. So like I mentioned before, if you could fit 2 minutes into your day, then that's great. For adults aged 18 to 64, accumulating 150 to 300 minutes of moderate intensity physical activity, or 75 to 150 minutes, that equates to about an hour and a half to 2.5 hours of vigorous intensity activity, or a combination of the both each week. To do muscle strengthening activities on at least 2 days a week. And you want to minimize the amount of time spent sitting, or you want to break up your sitting. For our older adults, so those who are 65 and over, one of the first guidelines is that older people should be doing some form of physical activity, no matter what their age, weight, health problems, or abilities. They should be active every day in as many ways as possible for at least 30 minutes of that moderate intensity physical activity. And so I wanted to go through the difference between moderate and vigorous as well. So moderate intensity is that puffy exercise. So yeah, you do work up a puff, but you can still hold a conversation with someone. So things like walking and dancing. And our vigorous activity is when it's a bit difficult to hold a conversation. So we get very, very puffy. And I do want to emphasize that if you, from that last slide where you looked at what you're currently doing activity-wise, if you find yourself currently inactive, I don't recommend going straight up to that 150 minutes in a week. I recommend that you start to just build your way up, work your way up to meeting that benchmark. And that's going to be the safest way for you to get there. If you also need any help just to get started or want some more variety as well, I do have some Facebook videos on our website, on our Facebook, with some exercises that I release every week. But if you go back through the archives, there's a lot there for you. I'm going to link you to that in that email tomorrow. So I thought I'd mention a bit about exercise physiology and what I do as an exercise physiologist. So exercise physiology combines the science of the body and its systems, so physiology, mixed with the science of movement, and we do that to create movement strategies to assist with a range of health conditions. So you might be thinking, oh, exercise physiology, isn't that just a fancy name for physiotherapy? Well, both exercise physiologists and physios are both recognized allied health professionals. However, physio's just been around for a longer period of time, so it's just more well known at the moment. Exercise physiologist, so I treat patients using clinical exercise strategies and as my main way of treatment. Although there's also a strong focus on behavior change and self-management concepts, and I really love just the journeying with a patient from where they start to meeting their goals as well. So we also take into account, your environment, your life scenario, your side effects and medications, and we do that all, and we create something that helps you get the best out of your life. So physiotherapists, they do a bit more with the kind of diagnosis and that acute stage injuries and things like that. And they use more manual therapy techniques as well as exercise. So we're more exercise, that's what we're trained in. So exercise physiologists are the most suitable health practitioner to write a movement strategy for you and supervise an exercise program and to journey with you. So this brings us to the end of the formal presentation. So I just wanted to summarize what we've talked about today. So first of all, our body changes with aging are normal. So remembering our gray hair and our wrinkles happens on the inside of our body with a number of different things going on. So aging can have significant effects on our muscles, our bones and our joints, our brain and our balance. But there is hope. So physical activity can help to prevent or prolong the onset of our age-related changes to our body. So our bodies are more capable than we realize. And another point is that chronic disease diagnosis is not a life sentence as well. And so there's exercises and exercise movement strategies that can help you improve your quality of life. We also went over the National Physical Activity Guidelines, which you'll receive a link in that email tomorrow as well. And that finally, the exercise physiologists, we are here to assist you and we play an important role in your continued well-being. So that's the, the formal, presentation finished. However, we'll have a bit of a Q&A time now. So I do thank you for those who have sent through their questions. I might not get to all of them tonight. So if I don't answer your question, please email it through on the details below, or on the screen, sorry, to that email, and I will answer you personally. And so the first question I have is jumping to conclusions considered to be exercise? So it's, and it's a joke, of course. However, it can be a unhelpful thinking strategy for some things. So things such as, I've got a diagnosis of osteoarthritis in my knee. I can't walk on it. I can't wake there. I can't do anything that I used to do. That is something that can jump to conclusions when really, again, our knee is a lot more capable of what we might think. And unfortunately, specific words can trigger things in us as well. And so a diagnosis of a specific thing can be, can make us jump to conclusions. So it's worth, seeing a health professional and getting some advice around those kind of things. So yeah, if you do have any other questions, please send them through. All right. So, so you're just using that question and answer button down the bottom. You can write in your questions. All right, we had a question here. So what's the best way to work on progressive overload? So general exercise or specific areas of weakness? And does a 30-minute session have as much benefit as a 60-minute session? It's a really, really good question. So best way to work on progressive overload is to abide by those physical activity guidelines to start with. And then the best way to do it is, I like if you're just trying to do for general strength, you go to about 8 to 12 reps. That can be your rep range. Once you're reaching 12 reps and it's getting really easy, it's not really feeling like it's doing a lot, that's your cue to step it up a little bit, either by doing a different exercise or by increasing the weight usually. General exercise, so it's good to work on specific areas of weakness. So for instance, if your balance is an area of weakness, you've probably got one side that's a bit better than the other. And so training your weakness is going to be the best thing to avoid any injuries or any worsening of conditions down the track. And does 30 minutes have as much benefit as a 60-minute session? It does depend on what, I guess, you're doing in your session. So if you're doing, half an hour of walking, half an hour of weights, that kind of thing, then that's great. But again, use those physical activity guidelines as a bit of a gauge as to what you're doing. Again, for adults, you want to be doing at least 2 sessions a week of those muscle strengthening exercises, although 2 to 3 is fine. You just want to have about a day in between, just to make sure that there's enough time for your muscles to recover. And so if you can only fit in 3 60-minute sessions a week, then that's great. If you can fit in more 30-minute sessions a week, then that's great as well. Great questions come through. Does cleaning the house count towards an older person's exercise? So this is something that I hear commonly as well. I think it comes back to that moderate to vigorous kind of exercise classification. So if cleaning the house makes you feel a bit puffy and it's a bit difficult to hold a conversation, then I would count that as moderate exercise. However, if you're doing things that you're not moving around a lot, then I wouldn't classify it as exercise, but it's still movement. And for an older person or an older adult, the guidelines say to move as often as possible. So I think in that case, then cleaning can definitely, I guess, count towards it, but I would just count that cleaning that kind of makes you a bit puffy, like you're raking or you're sweeping, vacuuming, that kind of thing. Can I claim exercise physiology under a health fund? So another great question. So we are recognised as allied health with most health funds and with Medicare if you are on a care plan from your doctor. And so you do have to check with your health fund if your extras cover exercise physiology. Usually, because it's becoming more of a recognised profession in allied health nowadays, more health funds are covering it. So if you do want any more information about item codes and things like that, then just email through and I can give you that information as well. So when do you know if you've overdone the exercises? So I think with this one, again, you want to think about, if it's starting to hurt when you're doing an exercise, if you've had a good go at it and it's still not really improving, or it's starting to be a bit bothersome for you, it's worth probably seeing someone to see if you're doing it correctly, first of all, or if there is, I guess, a way that you can modify the exercise so that it doesn't cause any dramas for you. So I guess there's always people you can go to ask for advice if you think you've overdone something. All right. So if there's rigidity in the joint, should you simply do more on that joint or less? Great question. I think for this one, you need to probably think about what you're doing or exercise you're doing with the joint as well. So you do want to still load bear. However, you want to do that safely and again, progressively. If the joint's really rigid as well, you want to focus on maybe doing some flexibility exercises as well. And so I guess it does depend on what joint it is. So if it's something like a knee, then you definitely still need to be doing exercise on it because it's one of our really, really important joints. But yeah, doing mobility exercises are going to be the best way to decrease the rigidity in that joint. Excellent. I just had someone who is 61 and they're bodybuilding. That's excellent. And they've just finished their Cert 4. That's wonderful. Do we need to stretch after every exercise session? That's a great question as well. I would definitely recommend stretching after exercise because what it does, it helps with the venous return of the blood, so we don't pull up all of the liquid and the fluid in our blood that might tend to cause other issues later on. It helps to relax our muscles. It helps to cool down our body and our heart rate as well. And so, and it really helps to keep our muscles long and strong. And so if we're just contracting our muscles and we're not doing anything afterwards, then sometimes they can stay contracted and lead to tightness. So it is really important to stretch after exercise just by doing some static stretches. So I do have a Facebook video series on that as well if you'd like to go and see it. Motivation is my biggest hindrance. How do I get myself in the right mindset? So that is a really, really great question. I think is to get yourself into the right mindset, you have to think about, what am I willing to change to be able to meet my goal? So I think having a goal is an ultimate goal is the most important thing, but then having little goalposts that lead you up to that big goal. So if your goal is to be able to walk 5 kilometers, set the first goal as being able to walk 100 meters, and then 500, 1 kilometer, this one here, and then just keep going like that. So don't set yourself a goal that's too overwhelming. I think is going to be the best way to get yourself into the right mindset, and think about why you want to achieve that goal. So it all comes down to your why. So if you want to lose weight, for instance, why do you want to lose weight? Is it because you've been told by your doctor? Or is it because you want to be around for your grandkids you want to be able to run around with your grandkids without getting puffed? You want to be able to decrease your the load on your joints to be able to stand up and walk upstairs. So I really encourage you just to sit down, think about your why, that'll get yourself into the right mindset. And again, if you do need more help with that, then people like Joe who can help with counselling are a really great place to get started as well. Excellent. All right. So in the slide that illustrated the difference between young and old muscle, what are the yellow dots representing that are present in the old muscle but not the young? So I'll go back just so I can... Here we go. So the little dots, that's representative of that fat infiltration. So the fat, that little adipose cells infiltrating the muscles, which can lead to that changes in that composition, as we can see in there. And so that can affect the innervation, which are those black lines, because of that change in composition. All right. Okay, so another one we've got is, where is it first? So modifying exercises due to osteoarthritis in lower back and hips, and that how one-on-one exercise classes every day. So I'm just trying to fix all these together. So are exercises like body pump, body step are too jarring for lower back and hip osteoarthritis? I think if you're getting pain from doing exercises, I think that's when it can be a bit concerning. Again, like I mentioned before, there's normal degenerative changes, but I think if you're finding that those exercises are becoming a bit painful, then definitely then modify them to what suits you. But again, you do need that load to be able to have that overload, the progressive overload, like what we talked about, and to increase the bone mineral density as well. Another question I've got, is walking each day enough for an older person? So walking each day is great, but again, and I do encourage you to keep walking if you are, but again, including some more of those muscle strengthening exercises are going to be the best way to prolong any onset of negative effects of aging as well. So excuse me. I'll just check and see if there's any other questions that have come in. Just looking around there. So I've been told that taking collagen can help with the pain of arthritis. Suffered dreadfully with pain in my knees, also feet and hands. Done a lot of manual physical farm work all life. So I think I would, before, taking collagen or, getting cortisone injections and things like that, I think the best way is to go with a bit more of a conservative treatment, such as exercise and, some physio can help as well. It's great that you've been physically active all your life. I think that's so important. And again, sometimes our joints can suffer from that. But I think trying to go down a bit more of a conservative route with exercise is the best way to go first. And then if that, it doesn't have the effect that you would have liked it to, then I think, other treatments and things like that can help to reduce the pain. All right. Another one here, should you push through discomfort or some pain? So that's a really, really good question. I think depending on the condition or what you're exercising through, is you may have some discomfort with some exercises, but that's sometimes the only way that the joint is going to adapt. So for instance, if you've got pain and you keep reducing and reducing and reducing, then our tolerance is reduced, when really used to be out here, but now it's down here. So to get it back to being out here, we're going to have to gradually expand our tolerance, and there may be some pain in that. With stretching, I always say to stretch to discomfort and not pain. That's just something that's a really a good way of looking at it there. So again, do be careful with what you're exercising. If you do need some guidance, then seeing an exercise physiologist, personal trainers can help as well, physiotherapists, for some more guidance around that. Is 25 minutes of walking each day enough exercise for an older person? Again, we'd love to aim for 30 minutes at least for an older person, but 25 minutes of walking is a great way to get started. Another question, when is the best time of day to exercise? Whatever time suits you. There's no real best time. If you're a morning person and want to get out and do it, then that can often be a great way to get it over and done with. If you are one of those people who doesn't like exercise, by waking up and doing it first thing in the morning, then it's done for the day. If you're someone who is not a morning person and doing it, when you get home, even though from work, for instance, it might be a bit hard, but it always makes you feel better, helps with your sleep as well, no matter what time of day you do it. So just doing it is the main thing. You take magnesium, fish oil, a multivitamin, and MSM, which is supposed to help. So again, I think as a GP or a dietitian would probably be the best person to talk to you about your supplements and things like that. Obviously, calcium, fish oil is great for your joints, and omega-3, keeping up the vitamins and everything like that. I think I'm a big believer in that food is the best way to receive our nutrients. But again, if you need extra help from vitamins and supplements like that, then go ahead. All right, so I think I will leave it there. Thank you so much for joining me tonight. I really hope you found this presentation helpful, and that you got something out of it. I'd love you to in that email that we'll send out tomorrow, there's a little feedback questionnaire. So if you did get something out of it, please let me know. And again, there is my email on the screen if you would like to email me through any questions you might have. And if anything from the webinar has brought up, you know, oh, I should you know, start exercising, I should do more, I should get some help with what I'm currently doing, then I'm here for you. Currently have an offer this month as well that your first 2 exercise physiology appointments are 50% off. So pretty much you can you get an appointment free. So I really encourage you to do that. Check with your health funds if it's covered as well. But I would love to see you, love to meet you, and love to be able to help you improve your quality of life using exercise. So thank you so much for joining us, and have a great night.